Seen what we've seen when we look at sexual and reproductive health services broadly and holistically is that in practice, we've kind of lost that emphasis on the positive aspects of sexual well-being and sexual health, including sexual pleasure. And so what you see there on the left, you can see our WHO operational framework for sexual health and reproductive health, and a variety of spaces that fall under our big SRHR family in which we all operate. We see this real strong push to prevent ill health, to focus on risk reduction, disease prevention, et cetera. With some notable exceptions, we've seen efforts to be more inclusive of adolescents and youth. But if we focus on anything related to sexual pleasure or the good parts of sex, it's oftentimes been seen as, a political liability at worst, and just extraneous to the key health issues at best. Next slide, please. So it was against that backdrop that back in 2020, we at WHO and HRP partnered with Anne at the Pleasure Project and some other colleagues there, Oxford University, and had some really generous funding from the case for her to basically see whether for our SRHR space, we could come up with an evidence-based argument to include sexual pleasure considerations in SRHR interventions. And so that was the question: do SRHR interventions, which incorporate sexual pleasure, improve relevant health outcomes? That was the question that drove our review. And if you take a picture of the QR code, that will lead you straight to the published review itself, so you can take a look at that later. Next slide, please. The result of that review was an enormous amount of literature that we had to screen through. We looked specifically at the contraception and HIV literatures because even within the SRHR space, they are really the robust areas where we've seen a lot of innovation, a lot of evaluations, and decades worth of evidence. We started with about, after deduplication, going on 8,000 articles, and ultimately ended up with 33 unique interventions, which were included in the systematic review, and 8 which we were able to meta-analyze. Next slide, please. The majority of these interventions, just to give you an idea of where they were distributed geographically, were from the United States, 25 of the 33 interventions. 8 of them were delivered elsewhere. We had 2 in South Africa, 1 each in Brazil, Mexico, the United Kingdom, Spain, Nigeria, and Singapore. And what we found from this review, from the narrative synthesis of the 33 studies, were that interventions with pleasure components have positive effects in a wide variety of outcomes, ranging from knowledge, motivation, all the way to behavior. And that is when they're compared with usual sexual and reproductive health care or no treatment. Even more crucially, when we were able to meta-analyze specifically around condom use, because if you can imagine, the interventions that were included were a wide variety of interventions looking to affect a lot of different outcomes, but we were able to find 8 studies that looked specifically at condom use, and we found significant improvement of condom use compared to usual sexual and reproductive health care, which was really exciting. Usual care being, of course, care that's not including sexual pleasure. Next slide. Another important finding as well, I would say, equally so, in a way that will kind of structure, I think, part of our discussion today, is that not all pleasure inclusive interventions are alike. We kind of described a spectrum of pleasure inclusivity. It's important to caveat it with that black box you see at the bottom, which is to say the vast majority of interventions had no mention of pleasure. But among the ones that did, not all pleasure was talked about the same. So we had examples of what we called borderline low pleasure, which really was interventions grounded in that risk reduction approach that is so familiar to all of us. And mentions of sex positivity might be along the lines of, using a condom doesn't have to, kill your sex life. So you're acknowledging pleasure, but not in a great way. Then you had in a medium kind of amber light approach, you had interventions that would eroticize condom use for safe sex. And these tended to not have really pleasure as a key focus and might come in anecdotally. A lot of these interventions were grounded in empowerment approaches, or had another kind of like maybe a gender-based approach as well, where it just wasn't the primary focus. And then the gold standard interventions we found were those that were pleasure inclusive, sex positive, didn't stigmatize sex, and just kind of considered, people's desire for sex and sex that's good to be a normal part of the human experience. Next slide, please. Following publication, when this came out, I think in 2022, Valentine's Day, there were a lot of headlines. It was a huge, I think, moment in this space, a very useful one for people who care about it, because what we had done was we had linked pleasure, sexual pleasure inclusion, to the potential for progress in sexual and reproductive health outcomes that we all care about. So it was a win-win for people who were advocates for sexual pleasure and also people who wanted to just positively affect SRHR outcomes. Importantly, with me working for the World Health Organization and, our partners within the UN as well, it was a firm footing for us to be able to talk about this and work on sexual pleasure in the future, because we are an evidence-based organization. We have to go and operate where the evidence is. And now we had demonstrated that there was evidence to be able to talk more openly about sex and sexual desire and sexual pleasure. And so I give some examples of tweets that, a couple years ago, I never would have expected to see WHO or our sister agency, UNFPA, put out, but now we could kind of safely do. Next slide, please. I think I've got like about 3 slides left, and I want to focus on kind of where we're looking moving forward. So the challenge, of course, is that there's been a lot of enthusiasm for this space, but how do we convert that into action in programs and services? I would say that we have this inertia that is decades of a risk reduction, disease prevention approach. And I've seen that show up in a couple of areas. One of them specifically, that this idea that like, oh, pleasure, so glad we're talking about sexual pleasure. It's really important for the youths. And it's like, well, yes, I mean, of course, our ASRH colleagues lead in this space, but sexual pleasure and desire are normal parts of the human experience. And we don't want to see this as a strategy for one set of individuals in particular. Also, I would note that certain programs are moving slower than others, and the contraception universe is one of those. Next slide, please. Every single one of those 33 interventions that I mentioned previously came from the HIV space. Even though we searched the family planning contraception community, we found nothing that warranted inclusion in our review. So in order to kind of reach the family planning community where they are, we presented this at ICFP in 2022. There was a lot of enthusiasm, but people didn't really know what to do with this. So we decided to work with our partners in the IBP network, and our other group of partners who've been involved in the first review to try to meet the family planning community where they are on an area that matters to them. So we're currently in the midst of finalizing a second review that's going to attempt to quantify the extent of contraception discontinuation and switching that happens as a result of sex life concerns. So trying to demonstrate to maybe the more conservative members of our SRHR community that whether or not we're talking about sex and sex lives, it's influencing contraceptive users' ability to take up and stay on contraception. And my last slide, next slide, is, what do we need to move forward? I would give you just a couple of suggestions. One is knowing your audience. Not everyone is a pleasure warrior, and that's okay. You can meet people where they're at and make an argument that makes sense to them. I think we need to do a better job in operationalizing pleasure, having a clear path from what the principle of a pleasure inclusive approach looks like to what that looks like in practice. And Anne and partners have been doing a great job on that. We need to be able to document interventions. I'm a researcher, and so I want to document everything, how we're developing them, what qualifies as good pleasure content, a good dose of that, and how can it be replicated. We want to mainstream pleasure into existing content, and we need robust evaluations to demonstrate just the effect that this is happening. I will stop there. I'm at time. Thank you so much.
Thank you so much, Leanne. That was really interesting, and I'm sure a lot of folks are excited to read the review itself. So thank you. Now I would like to give it back to Anne to talk about the pleasure principles and SRH programming.
Brilliant, thank you. And I'm going to talk exactly to the point Leanne left us on, which is about how to take this evidence and make it real and make it practical. And I know that Jess, Alfred, and Innocent are also going to speak about their experiences of that. And you know why this is important. We've seen from the evidence that it has a significant and positive impact on sexual health outcomes. And the fact that we have been stigmatizing, silencing, and ignoring pleasure means that there has been less condom use. You know, we know that from the research now. And if we'd done this at the beginning of the AIDS epidemic, we would have saved many more lives. So we need to think also about the effectiveness of our programs and why it's important to bring pleasure in a very practical way into them. So I'm going to talk about that. But on the next slide, I'm just introducing us at the Pleasure Project, just to sort of situate us. We've been around since 2004, flying the flag for pleasure, talking about the importance of putting the sexy into safer sex. And we work in a range of different areas. We build bridges between research world, the public health world, between people working in the pleasure industry, and also, very importantly, developing the evidence base for a pleasure-based approach to sexual health and rights. And on the next slide, I'm going to tell you what the definition is of sexual pleasure according to the World Association of Sexual Health. So the World Association of Sexual Health put out a declaration of sexual pleasure, which was the first one that a global normative agency had put out. They put it out in 2019, and this is the definition they included in that declaration. And I urge people to go and look at the declaration. It's a kind of call to action. This definition was heavily debated. So in answer to the question of what is sexual pleasure, this is a definition that's been heavily debated and agreed and can be used. But what does this mean for sexual health? On the next slide, I've also got a definition of pleasure-based sexual health. And this is one the Pleasure Project created, and we created this about 5 years ago. And I won't read it out, but we're really talking about, you know, making sure that, you know, building on the WHO definition of sexual health, which includes satisfaction, really saying what would it mean to have pleasure-based sexual health? What does that really look like? Build, you know, creating and aiming for a vision of good sex built on sexual rights, and something that celebrates sex and sexuality and what they can bring into our lives. And there you can see, you know, one that really encompasses well-being, safety, pleasure, desire, and joy. So that's what pleasure-based sexual health is. On the next slide, I talk about why this is important. So this is a synopsis of a technical guide that, again, the World Association of Sexual Health put together, which is really good to read if you want to see what all the evidence is for why pleasure is important in sexual health. And just, you know, just a couple of those examples. One thing that we don't talk about very much in the world of sexual and reproductive health is the fact that safer sex can improve our physical and mental health. It can improve our heart health. It can improve our immune functioning. Also, we know that pleasure and sex positivities are not new inventions. These have been around since the dawn of time, and there's actually been, particularly in pre-colonial times, you know, in many of the in Africa and South Asia, for example, a much more celebrating of pleasure and a much more celebrating of community narratives around pleasure. We also know that pleasure has been something that has been part of faith narratives as well, and this WAS technical guide goes into more detail on that. We also know that pleasure positive approaches, there's research to show that they can be more helpful for people who have survived sexual trauma, which is a large proportion of us in the world. And that's because it offers a positive vision of what's possible, rather than assuming that a sexuality and a sex life won't be possible after sexual trauma. But it can also, pleasure can also challenge damaging gender norms. We might hear more about that later, in that it can stop, for example, female identifying people feel shame around their sexuality, or masculine identifying people feel that they have to always be proactive in sexual encounters, just for a couple of examples. On the next slide, I really won't, just given time, I really won't go into this in detail, but this is just showing the building of interest in pleasure-based sexual health, and a number of landmark moments, including ones that I've mentioned, the publishing of the Declaration of Sexual Rights, and also the research that Leanne's just spoken about. And I'm going to go on and speak about how we're now turning that into operational guidelines and how we're making tools to help you yourself integrate this into your work. And on the next slide, this is just a visualization of the research and that Leanne just spoke about, and what we've learned, the fact that pleasure in sexual health leads to good, safe sex, and the journey that we can go on in terms of adjusting our programs and you know what that means in terms of moving from approaches that aren't evidence-based, so moving towards evidence-based, pleasure-based sexual health. And on the next slide, this shows the pleasure principles, which some of you might be familiar with, or you may never have heard of them. These are 7 fun, inspirational principles which take the pleasure declaration, take the evidence review that we did, and take other best practices and turn them into guidance that you'll be able to use and that you'll be able to then dive into and see lots of kind of tips and practical guidance to how you can actually implement this. They're not a checklist, they're fun, they're ones based on people's experience of implementing pleasure-based sexual health, and you'll find them all on the Pleasure Project's website. You can go into each part of the wave, the pleasure principles wave, and read best practice examples. You can see how this relates to your own experience, and I'll just pick a couple and tell you why they're important. So first of all, all of the pleasure principles are based on the fact that we need to flip the narrative to be more positive around sex and sexuality, but also they're based on sexual rights. Sexual rights are absolutely critical and the backbone for the pleasure principles. But we have a pleasure principle which is think universal, and that really talks to the fact that everyone has the ability to experience pleasure if they want to. So it's really about being very inclusive in terms of how we think about pleasure and pleasure-based sexual health. But then we need to be flexible, and we need to be, with our knowledge of our context, we need to be aware of how to talk about pleasure and meet people where they are, as Leanne said. But also we have these other principles which are about how to communicate pleasure-based sexual health, how it's important to keep building up the learning and the research. And then the one that I like the best, which is love yourself, which is about also unlearning what you may have learned in your own sex education or life in terms of stigma and shame around your sexuality. Okay, so I will put the link to the pleasure principles in the chat, but just hurrying along, on the next slide is the global mapping of pleasure, which is on our website, which has many examples of people doing pleasure-based sexual health. So please do check that out to see examples in your area. And then just very quickly, a couple of examples of people who have actually taken the pleasure principles into practice. These are the digital media to create sex education that's evidence-based but pleasure positive. And then the next slide shows an example by the International in their Africa region of a campaign we did with them called Treasure Your Pleasure, which was actually all of their digital content was pleasure positive, and it was a huge success. The next slide shows how many young people it reached in Africa, which was 9 million. They had a huge upswing in people actually going to their social media channels, and they saw some differentials in terms of their health clinic usage as well. So there's great examples of actually taking the pleasure principles and putting them into practice. Next slide is just showing you that we've published an evaluation of this, and you can find that on our website as well, which has got really clear steps about how the learning that we had from Treasure Your Pleasure. And then couple of slides, I'll resource that you can use, which is published with IPPF in their Southeast Asia office. I don't know if the next slide is coming up. That's it. So please, that's about working with young people and how to take forward pleasure-based sexual health. And this is really the introduction to Innocent and Jess Alfred's work. We worked with Amplified Change, and they'll talk more about that, with a range of different 8 organizations who took the evidence and pleasure principles and put it with their work. And you'll hear more of that. But just to finish on the last slide, we've also published learning from that partnership with Amplified Change, and how all of these very varied organizations implemented pleasure-based sexual health. And I can put these links in the chat. And that this is again an evaluation of the work that we did, but we've also made a best practice note and a very practical note in how to learn from the work that we've done. We can just finish on the last slide. Thank you.
Thank you so much, Anne. And now we're going to have a very quick Q&A with the presenters so far. If you haven't already, please do add your questions to the chat, and I'm going to turn it over to Sige to moderate the Q&A.
Thank you all our presenters. Thank you, Anne. Thank you, Leanne. I ask Grace to come up from the mute if there are questions in the chat. Otherwise, please come off mute and ask questions directly. Grace, do you have any question in the chat?
There's one comment that they might be able to speak to more. It's from an engender health colleague, and it talks about it would be great to learn more about being pleasure positive at the workplace, or even complimenting a colleague may lead to an offense per the law. So about the workplace and talking about this in that context.
Should I try with that one?
Please do, Anne.
Yeah, I mean, I think what we've been talking about is about the importance of integrating discussions of pleasure into pleasure-based sexual health. And as I said in the pleasure principles, what's really important is this is based on sexual rights. So everything that we know about sexual rights is absolutely critical. Such learned about consent, what we've learned about good communication, what we've learned about the importance of respectful communication. And all of that is absolutely central to sexual rights. And so pleasure-based sexual health is no different from that. It's, I mean, making a compliment that somebody might not want or that might be diminishing to them is no different from what we know around sexual rights. I think what we're saying is that it's just about stopping the silence around people feeling comfortable to think that, and us recognizing that people have sexual relations and sex for positive reasons, for bonding, for intimacy, but everything that frames that is around the importance of sexual rights and respectful communication. And actually in the Talk Sexy pleasure principle, we have exactly a lot of information about how to make sure that when you are having these conversations, you're doing them in a respectful way, and that you're not personalizing them in a way that is disrespectful, and how to start that conversation. I know sometimes it can be challenging because we haven't been used to talking about pleasure in our professional capacities, so we might find it challenging to then do that. But Talk Sexy, our pleasure principle, has a lot of guidance about how to do that in a way that still adheres to good professional practice and good communication practice with our colleagues. And I'll just put a link to the pleasure principles in the chat as well, just to say that it's great that Engender Health is here because they're one of the endorsers of the pleasure principles. It'd be great to hear who else is there. We've asked organizations to endorse the pleasure principles, and organizations have taken actions towards that. You know, we've got you know, many of the most of the global SRHR organizations have endorsed, such as IPPF, PSI, DKT, and it's a great community of people and organizations. We get together about once every 6 months to share examples, to talk through challenges. We've had some great presentations, Amplify Changes and other endorsing organizations. If there's any other endorsing organizations here, organizations who have endorsed the pleasure project, the pleasure principles. Thank you.
Thank you. Grace, there are other questions. Can you just come off mute?
Yeah, there are quite a few. We have one from Dominic, who would love to hear more about the relationships between gender norms in teaching and learning about pleasure, and then those related outcomes, specifically whether there's a theory of change or a logic model.
I mean, I can try that one, Anne. I think, and you please feel free to add. I think this is not, I've seen this anecdotally in some work I'm working on right now, where I think in our review, for example, we kind of qualified those mentions of pleasure nested in an empowerment or another type of intervention as an amber, because, you know, it wasn't the primary focus. And I say empowerment, keeping in mind that a lot of this came from the HIV space. What that often was, you know, economic empowerment or life skills. The idea, if you think about the messaging that, you know, from those campaigns of, you know, make plans for your future, like stay in school, like I have control over what I want, and therefore I'm going to use condoms, therefore, you know, I'm going to get tested regularly for the HIV space. You would find pleasure kind of incorporated through there. And the other, of course, the other one is a gender empowerment perspective as well, of like, you know, where we're talking about bodily autonomy and asserting yourself. We saw it in that context, and we saw beautifully where pleasure could kind of factor in, like, therefore I will find ways to eroticize condom use and make it fun for me and my partner. Or, you know, I'm, you know, happy to advocate for like learning how to make putting on a condom sexy, and therefore I, you know, can have this autonomy to be able to achieve what I want later on in life. I think that there's some very interesting, I mean, kind of with what Anne was saying about the sexual rights space and the idea that like autonomy and empowerment are part and parcel of that. I think that there's probably some very interesting work to be done that can see how, for example, people who report being able to have satisfying or pleasurable sex lives, you know, whether they are inherently more or less empowered in other ways, if it's an interesting proxy. I am putting that out into the universe. I'm not necessarily saying that there is a categorical link. I think it'd be a very interesting place to see more work. But I think, I don't know if any of the pleasure project work, Anne, if you guys have come up with more of a specific logic model that maybe you can share.
Yeah, I agree with you. I mean, what we've seen in Works World is that there tends to be a focus only on stopping things. So, you know, reducing maternal mortality, encouraging young people to learn how to say no. And we saw that in our review, that empowerment was defined as learning to say no, whereas I would argue that we can't properly consent to something unless we know what we also want to say yes to and what the choice is. And we're actually doing a piece of work now to kind of try and fill the gap between the fact that the gender equity world and gender equity frameworks tend to not have sexuality within them, or in a very negative way, and the world of sexual well-being and pleasure-based sexual health, which has started to look at this more. And we're looking at, we've just finished a literature review and are looking at creating a framework that would actually be potential indicators that would look across the two of them. And we're working with our partner in Brazil, who is also, and they are looking at also people's lived experience and what does empowerment feel and look like for them in terms of their sex lives and their sexuality. So we're hoping to replicate that and come up with a suggested framework. I think there's very very small amount of research which actually looks at sexual well-being and pleasure as an indicator of empowerment. But I would argue that that should be something that should be in there more. And there's some more discussion about that when it comes to sexual well-being indicators. But yeah, I think it's been an ignored and silenced area. So yeah, good question.
Thank you so much. And I'm sorry to cut this short, but I want to make sure we also have time for our other presenters. We can come back to some of these questions in the discussion as well. So just give me 1 second to share my screen here. I'm pleased to turn it over to Innocent Grant to talk a little bit more about the Young and Alive initiative. Innocent, take us away.
Yep, thank you so much, Olivia Carson, for having me, and many thanks. Really nice to join this session on ways we can learn on how to integrate pleasure into adolescents and young people's sexual and reproductive health and rights programming. And I'll be presenting an experience of the work that we did with Young and Alive initiative in Tanzania. So when you go to the next slide. I'm also a very good fan of putting these pleasure principles up there. And Anna just said on my behalf, love yourself is one of my favorite pleasure principle, and just gives some really positive vibes to me personally and individually. And I think when you have positive vibes, you know, when you love yourself, it automatically trickles to anyone next to you and your partner as well. And it helps to empower yourself and, you know, feel the pleasure. And then when you go to the next slide. So I want to share about what has been done in Tanzania in testing the pleasure inclusive sexual health intervention with the partnership project that we did with the Amplify Change and the Pleasure Project, but also be nice to learn and collect experiences and suggestions on how to improve our interventions within our communities. When you go to the next slide. Now let's talk about sex. I just added this slide because we have one music. Young and Alive is doing a lot of SBCC. So one of the work that we do is using music to promote sexual and reproductive health education. And I added that slide of this song called Lambaskari Gulu, which speaks about positive aspects of pleasure. And this was a product that was produced by young people themselves after we trained them on issues related to sexual health, and was just interesting to hear this music and you know, when we started learning about, you know, integration of pleasure within sexual health intervention. Now, when you go to the next slide, I want to do a special focus for this program called Young and Alive Fellowship Project. And maybe before I dive into it, I would love to explain. So when you check on the Young and Alive Theory of Change, it's very simple. It's about empowering young people to become active leaders and advocates of sexual and reproductive health, and then giving them the platform to bring change within their own communities. But despite numerous efforts in Tanzania that have been, been taken to place young people at the center of SRHR movement in the country, but there's still less capacity building in working with young people. So it's to make them to help them becoming active champions of sexual and reproductive health and rights. And for so many time, it hasn't given us very good outcomes as we expect. I would give an example, for instance, in the previous few weeks when we were chatting within the National Family Planning Technical Working Group, we're analyzing the report, the Tanzania Data Health Survey report, which shows, you know, in Tanzania, regions which have got high modern contraceptive prevalence rates are also regions with high rates of teenage pregnancy, which actually shows that, you know, young people are not, you know, the intervention we design are maybe not responding to their needs. And when you talk to young people in Tanzania, you know, they're not doing sex to have pregnancy or to get pregnancy or other outcomes, but they're doing sex for pleasure. But no one talks about pleasure. And that's why we decided to integrate pleasure within this Young and Alive Fellowship project, which is aiming at building their capacity to become leaders in the space of sexual and reproductive health. And automatically that trickles to have better outcomes on the group of young people. When you go to the next slide. So Young and Alive understand that we won't remain young forever. It's just repeating the information I shared before. So that's why we came up with this intervention of empowering young people to become active advocates. And then it's very important to have these youth-led movements in countries. And then, you know, for so many years, as I said, the only approach that has been used is fear-based. My friend Anne was writing in the chat. It's about stopping sexually active young people to not do sex. It's about, the trainings are always, we've been shown pictures of people suffering from gonorrhea, people suffering from various complications. That's how it looks like. And young people are fearing from getting into these movements because it's not attractive. It's always fear-based, and, it's not effective. As I say, the outcomes are not very, very promising. When you go to the next slide, I've pinned, so these are the ways that we did integrate pleasure within the intervention. So first, we designed a Swahili sexual and reproductive health curriculum, or we could call it a training manual. And in this curriculum, we just wanted to be a bit different, not as from the traditional ways of delivering sexual health intervention for young people. As I said, normally you would have an older adult or someone or a nurse or a doctor coming in my class, showing us pictures of people suffering from gonorrhea, suffering from syphilis, really scary pictures, so it's to make us feel sex. So we wanted to be different a bit from that traditional practice and integrated the principles. It's about having fun, it's about being happy, it's about healthy relationships, it's about good communication during among partners. And then we used this curriculum in the fellowship program with young people that apply to be part of the fellowship. So this is a group of 15 young people. So we use the same curriculum to spark dialogues among them, to train them during that leadership curriculum. And then young people themselves were being given resources to host community dialogues within their communities. We developed some few scenarios around pleasure and sex. And then these scenarios were used to spark dialogues, to spark community dialogues within the communities that were coming. And it was just very interesting that for the first time you see within sexual health dialogues, discussions are becoming very funny and everyone is becoming very engaging and they're sharing their own experiences. And was just very different from that traditional practice, as I said, of fear-based approach, where people would be very calm and people would be very fearing and very quiet, and it's not very engaging. And at the end of the day, we just see, the movement that we are aiming at Young and Alive, having more young people coming into the sexual health movement in Tanzania, is growing. And we're now hosting National Youth Summits on Health and Development with a lot of number of young people who are, very positive about sex. And automatically, as we said, it helps in promoting safer relationships, healthier relationships, communication during sex, and people talking about consent and issues like that, and not as in a traditional way that was being done. When you go to the next slide, I think I've added this 2 minutes video that I'd love you all to see on how we were doing in the Young and Alive Fellowship Program. If Olivia can help me to play that.
Yes.
Very helpful.
1 second. Thank you.
Thank you. Hi, my name is Innocent Grant. I work at Young and Alive Initiative in Tanzania. Pleasure-inclusive sexual health is important because it is not only needed but mandatory to young people. Most of the information we provide in sexual health comes with negative and preventive approaches and leave behind the right and positivity of prevention, for which sex negative education haven't given us positive outcomes so far. For instance, in Tanzania, where sex education is always negative, and we still face high rates of teenage pregnancy, HIV/AIDS among people, and sexual and transmitted infections prevalence. Including pleasure in our work, we'll tackle all misinformations on pleasure, but also we'll make the champions that we are training to have another language of informative approach to a sensitive matter like sexual and reproductive health and rights. For instance, our very first discussions with 15 Young and Alive champions on pleasure-inclusive education was exciting. The discussion was filled with sexual pleasure stories and stories that speaks of young people's experience. When assessing the value of the discussions, we thought of drawing two sides. What are the positive aspects of sex and pleasure, and what are the negative aspects of sex and pleasure? Example, pleasure positive themes included love, consent, love language, communications during sex, comfortability during sex, and solo sex. While pleasure negative themes included positions, using force during sex, into bracket consents, and lack of communications. Understanding all these aspects that came up during discussion, what we immediately learn is that pleasure-inclusive sex education is funny and makes sex education more youthful and engaging. Pleasure-inclusive sex education automatically brings in important aspects of health sex relationships like consent and communication, and not just negative fearing thoughts of sex. And we think this is very important for the future of sexual and reproductive health and rights programming. Donors like Amplify Change play a great role in supporting sexual and reproductive health and rights initiatives around the world. Funding pleasure-based approaches in sexual and reproductive health and rights is like amplifying the importance of pleasure-based sex education. Amplifying pleasure-based sexual and reproductive health and rights approaches is equal to promoting safe sexual practice among sexually active young people, understanding our sexual diversities as young people, and challenging harmful cultural norms that limits discussion on sexual pleasure or makes discussion on sex a taboo. But also at the end is like promoting integration of pleasure-based approaches into our programs, designing, implementation, and monitoring. Thank you so much. Yep, thank you so much, Olivia. It's just fun to watch myself 2 years ago. That's when we made this video. And when you go back to the presentation, also, I don't want to be misunderstood on the themes that were coming as people would understood as and negative outcomes of integrating pleasure. But it's very positive to see when you're doing these kinds of dialogues, people are becoming more, opening to share their own experiences. And so, these are no-go points when, when I'm in my relationship with my partner. And these are the good points that I love when I'm in a relationship with my partner. So I don't want to repeat these, but these are coming from those dialogues during the fellowship and the community dialogues itself. It's about love and love language. It's about consent, good communication, comfortability of places. Pleasure goes beyond just sex. It's about giving, complimenting after the sex, like buying a gift or something else. Solo sex and body physics. These are just coming. And then we've got the next slide. These are coming as a no-go, issues like smell, positions, issues like first experiences always that was coming up, and then forcing, which is like not using consent. And then it was very interesting to see when we're talking during these dialogues, people are saying, the discussion sometimes may feel very heteronormative, and then integrating pleasure in these discussions helps to disrupt heteronormative kinds of sexual scripts that have been pushed to many young people, ignoring the diversity among this group. When you go to the next slide, I'm just trying to conclude by saying, so what we've learned is about this approach helps in widening the discussion of sexualities and sexual diversities, and gives a room for young people to actually discuss their differences in sexual orientations and preferences, and bring a chance for understanding each other's sexual preferences as well. But also it's the best way to spark conversation. As you would see when we're doing these dialogues, everyone was very active and very engaging. And it appears to accelerate discussion about pregnancy and STI prevention. Automatically this comes in, and sexually active young people feel they have a right to engage in safe and pleasurable sex. And when you go to the next slide, so what we've learned so far, we feel like the movement is growing and no one is fearing coming into sexual health intervention because it's funny, and it's a happier, happy and fun movement that everyone wants to be into. So what we see is when you integrate pleasure in youth intervention, then we have stronger youth-led SRH movements, and we can see now our network is growing. We have more than 150 Young and Alive network members across Tanzania, and this is one of the picture when we were doing the dialogue during the National Young and Alive Summit that we did it in Dar es Salaam. And I've also pinned a very short video, but unfortunately due to time, I think I have to stop here, and maybe I can share the video on the link of what was happening in the summit. And then when you go to the next slide, it's me saying thank you for listening, and I would encourage every practitioner to integrate pleasure within sexual health intervention. Back to you, Olivia. Thank you.
Thank you so much, Innocent. And yes, we will paste the link in the chat to the Young and Alive Summit video. Really encourage everyone after this call to go and check it out. And now I am pleased to pass it off to Jess Alfred Nondo Ombene to talk about a pleasure-based approach to positive sexuality and midwifery in the DRC.
Bonjour, bonjour à tout le monde. C'est un plaisir pour moi d'intervenir dans cette réunion pour vous parler de comment l'approche de la sexualité positive basée sur le plaisir a été intégrée dans le quotidien de la profession sage-femme en RDC. Diapo. Slide suivante. Dans cette petite présentation, nous allons voir ensemble comment était la situation avant que notre association ait l'appui d'Amplify Change, et comment a été la formation et comment les sages-femmes se sont intégrées directement dans l'approche du plaisir dans les activités quotidiennes. Et puis nous allons découvrir ensemble quels ont été les résultats, qu'est-ce que ça fait sur le terrain. Tout n'a pas été rose, bien sûr, il y avait aussi les défis qu'on a traversés avant d'arriver à de bons résultats. Et nous allons aussi formuler quelques recommandations pour que cette approche soit réellement intégrée dans le champ pratique de la sage-femme en RDC. Slide. Suivant. C'est à partir des échanges et des discussions avec les femmes lors de leur séance de consultations prénatales que les sages-femmes ont essayé de sonder, de tâter le pouls et de sonder pour savoir la réalité et qu'est-ce qui se passe, qu'est-ce qui se dit autour de l'approche de la sexualité positive. Et nous avons découvert que les normes coutumières rétrogrades qui tournent autour de la santé sexuelle basée sur le plaisir faisaient à ce que l'approche ne soit pas discutée, ne soit pas dit et que le sexe ne soit pas dit en public. Et nous avons découvert que c'est dans nous-mêmes, les cliniciens et les sages-femmes, il y avait une barrière parce que tout le monde s'accrochait à ces normes. Et nous avions des messages de sensibilisation qui diabolisaient le plaisir. Nous-mêmes, on mettait une barrière parce que les messages qu'on transmettait ne montraient que le côté négatif du sexe, alors qu'il y a un bon côté positif de ce même sexe qu'il fallait peut-être intégrer dans nos quotidiens pour changer la donne. Diapo. Diapo. Je Massar avait été renforcé, c'est à partir de l'appui de Amplify Change que nous avons pu décrocher un financement pour intégrer cette approche de la sexualité dans nos activités. En fait, la formation, l'appui d'Amplify Change était d'appuyer la formation de 12 sages-femmes comme un pôle. Donc, c'était juste un pôle de mentors et les 12 sages-femmes avaient la mission d'aller répercuter leur acquis auprès de leurs collègues de travail. C'est ainsi que 12 sages-femmes formées sont allées aussi répliquer les autres. Et parmi les 12 sages-femmes, 10 ont intégré rapidement à l'approche dans les premiers 6 mois parce que ils ont vulgarisé l'approche parce que nous avons trouvé que c'était facile quand soi-même, nous-mêmes, les sages-femmes, on enlève la barrière. Nous-mêmes, nous corrigeons notre soi pour enlever le message négatif et aller dans le message positif. Et diapo. Slide. Et nous avons inséré l'approche basée sur le plaisir. Les 10 femmes qui ont directement compris et ont inséré rapidement, spontanément, l'approche dans leur pratique quotidienne. C'est-à-dire quoi? C'est-à-dire ces 10 sages-femmes, lors de chaque séance de planning familial, lors de chaque séance de consultation prénatale, elles parlaient avec les femmes et leur montraient et leur passer le message positif qui venait effacer progressivement le côté négatif que nous-mêmes, on avait injecté dans dans la population, dans le public. Et quand on faisait cette approche, il y avait quelque chose qui intéressait le public, c'était le protocole de Maputo, parce que le protocole de Maputo était un instrument qui venait vulgariser et donner à la femme et à la jeune fille l'autonomie et respecter ses droits. C'est maintenant, on a profité quand on vulgarisait ce protocole. Donc, que les femmes avaient bien accueilli, c'est à ce moment-là qu'on avait aussi profité pour intégrer l'approche de la sexualité. Et l'ouverture était bonne parce que tout le monde voulait attendre. Qu'est-ce dit le protocole de Maputo? En même temps, on a inséré l'approche de la sexualité positive. Et dans 6 mois, les sages-femmes ont dupliqué le message. Diapo. Et à la fin, les 12 sages-femmes ont fait les restitutions dans l'institut habituel là où elles travaillent et elles ont arrivé à partager le message, à faire arriver le message à 360 autres sages-femmes. Et ces 360 autres sages-femmes étaient appelées à intégrer progressivement l'approche dans leurs séances de CPN. Parce que la sage-femme vit le quotidien avec la femme. C'est la sage-femme a confiance dans le milieu rural parce que c'est la sage-femme qui assiste la femme pendant l'accouchement. Elle a toute la confiance de la femme et ce qu'elle dit, ça passe facilement. Et ils ont commencé à intégrer l'approche du plaisir dans les activités quotidiennes. Et parce que vous savez, dans la région où nous vivons, le sexe a été ou continue d'être utilisé comme une arme de guerre. Nous vivons dans une région à turbulence où la guerre est récurrente. Alors, avec l'approche du plaisir, nous sommes en train de récupérer certaines femmes traumatisées qui étaient victimes de la violence pendant le sexe et qui comprennent maintenant que le besoin et le nécessaire et l'utilité de négocier le sexe que de le faire et par force. Nous avons aussi intégré les hommes. Diapo. Les sages-femmes qui se sont intégrées spontanément, ils ont trouvé une stratégie. La stratégie était d'intégrer, de composer les groupes de parole qui ramassaient et les hommes et les femmes. Alors là, on parlait aux femmes et certaines femmes commençaient maintenant à exprimer leur côté négatif qu'elles vivaient avant d'apprendre l'approche du plaisir, commençaient maintenant à sortir des silences. Et ce sont ces femmes-là qui nous ont aidés à dupliquer l'approche dans leur communauté pour que les autres femmes qui étaient ignorantes de l'approche commencent à adhérer. Et cela nous a permis vraiment à récupérer une bonne partie des femmes qui étaient traumatisées par les antécédents d'un sexe mal négocié. Diapo. Slides. Maintenant, dans nos séances de sensibilisation, les femmes s'expriment à visage découvert. La plupart des femmes qui ont été touchées par le message ne cachent pas le bien, le résultat de leur participation à des séances précédentes sur l'approche de la société positive basée sur le plaisir. Et l'utilisation de l'approche commence à donner aux couples sensibilisés des expériences, des nouvelles idées contraires aux anciens messages. Parce que nous-mêmes, les activistes, les professionnels qui défendent le droit sexuel, on émettait le message du côté négatif. Mais avec la formation de Amplify Change, les acteurs ont changé. 360 sages-femmes sont maintenant informées comment ils peuvent dupliquer le message positif, montrer le côté positif du plaisir dans le sexe. Le sexe, il n'y a pas que de négatif. Oui, diapo. Diapo. Ces femmes savent maintenant que l'approche du plaisir fait partie intégrante des droits sexuels et des droits humains. Et nous avons compris que en faisant des analyses, en faisant les suivis, nous avons vu un indicateur de réussite dans notre zone d'intervention. L'indicateur était dosé par rapport au comportement des femmes lors des séances, lors des échanges avant l'approche et lors des échanges après l'approche. Donc, pour nous, l'approche qui était venue dans les communautés, surtout dans les milieux urbains, ça a été spontané et nous avons compris qu'il ne manquait qu'un déclic pour sensibiliser. Sinon, les femmes ne sont pas vraiment informées de l'approche, la communauté n'est pas vraiment informée et c'est pourquoi ils ont adopté, adhéré à l'approche. Diapo. Ça n'a pas été rose. Tout n'a pas été rose, comme quoi on a pris l'approche et l'amené de côté de la communauté et ça a adhéré facilement. Mais intégrer cette approche, nous avons utilisé la stratégie de créer les groupes de parole. Mais nous avons trouvé un obstacle, c'est quand il y avait un groupe de parole mixte où on pouvait parler de l'approche de la psychologie positive entre hommes et femmes. Nous avons trouvé que les hommes avaient tendance à pousser les femmes à ne pas s'exprimer parce que les femmes croyaient qu'en parlant du sexe, elles acquisent les hommes, vice-versa. Alors que progressivement, nous sommes en train de montrer à cette communauté qu'ils doivent vivre en harmonie avec un sexe qui amène le plaisir et pas un sexe qui est un outil de guerre. Le contexte socio-culturel de certains milieux ont donné la place moins évidente et empêche à cette approche positive à intégrer la sexualité chez eux. C'est-à-dire, à part la sensibilisation, il y a un tiraillement de l'autre côté, les gens continuent à tirer, comme quoi ce sont les enseignements, nous venons mal éduquer les enfants, nous prodiguons des conseils, nous entêtons les femmes, et il faut se voir au-dessus des hommes dans le foyer, ce qui n'est pas le cas. Et ça n'a pas été facile parce qu'aussi, il y avait un manque de moyens financiers pour continuer à intégrer cette approche dans toute la République. Sinon, au Sud Kivu, une partie de la province, les sages-femmes ont intégré dans les activités quotidiennes et l'approche de la sexualité positive. Diapo. Pour citer avec cette présentation, c'est juste pour présenter quelques recommandations. Il y avait une spontanéité qui nous a vraiment épaté, qui nous a donné la confiance de continuer avec l'approche. Malheureusement, il y a eu un manque de moyens, mais sinon, avec l'approche, nous allons essayer de toquer sur toutes les portes pour que nous puissions pérenniser cette approche dans toutes les activités quotidiennes, même dans le champ pratique de la sage-femme pour toute la nation, parce qu'avec la SCOSAF, nous avons déjà des échanges pour intégrer cette approche dans le champ pratique de la sage-femme. Et le diapo qui suit, c'est juste pour vous remercier d'avoir participé et d'avoir suivi cette petite présentation de ma part. Merci.
Thank you so much, Jess Alfred. And now we're going to pause again for a brief Q&A. So Sige, go ahead.
Thank you, everyone. Thank you to our presenters. Grace, can you check if we have questions in the chat? I know we had a lot of questions. Please pick some of them, given that we have only 5 minutes.
Yes, I don't know if we had any questions about Jess Alfred's presentation specifically. There were a few that we weren't able to get to previously. Unless anyone has a direct question for Jess Alfred, please go ahead.
Hi, good morning. Thank you. I'm wondering what about the training made the midwives accept the notion of talking about positive sexuality with women and even try it with men.
Et c'est de par les obstacles que les femmes ont avancés lors des séances. En fait, les sages-femmes au quotidien travaillent avec les femmes. C'est surtout les femmes qui sont victimes et ces femmes exprimaient chaque fois le besoin d'être informés sur leurs droits sexuels. Et c'est à partir de là que ça a commencé. Et j'ai commencé à solliciter un appui à Amplify Change qui lui a accompagné dans la formation. Maintenant, ce qui a changé, c'est parce que nous-mêmes, les communicateurs, étions un obstacle. On transmettait des mauvais messages en diabolisant la santé de la reproduction du côté négatif. On ne voyait que les maladies sexuellement transmissibles, on ne voyait que le VIH, on ne voyait que les grossesses non désirées, on ne voyait pas les côtés positifs de la santé sexuelle et reproductive. C'est quand nous-mêmes avons changé que nous avons été amenés à changer le comportement de la communauté à travers l'approche de la sexualité positive basée sur le plaisir. Merci.
Merci à vous.
Other questions from the audience? Olivia, we have just 14 minutes for the discussion, which just can go ahead and do the discussion.
Okay, great. Thank you so much. So we'll transition now into a discussion. We had, several rich presentations here, and I know a lot of back and forth in the chat. So really curious what your reflections are on the meeting. I'll give you a minute to read through the discussion questions, and please feel free to go off mute, anyone, and share your thinking. We can start with the first question, which is, how do norms and taboo around pleasure influence SBC for SRH service delivery programming? And why do we think it is that pleasure has historically been excluded from our programs?
La question est adressée.
This is just for everybody. We're going to have an open discussion. So if you have any thoughts, please go ahead. Jess Alfred, did you have anything to add in response to the first question?
Ici, les normes ont pesé négativement ont influencé négativement sur la santé sexuelle et reproductive, sur les programmes sexuels et reproductifs, parce que ce programme-là ne renforme pas que la santé, il y a aussi le droit. Et c'est ce droit sexuel-là qui avait tendance d'être écarté dans ce paquet de programmes. Et on ne parlait que de la santé sexuelle du côté négatif. Parce que aborder ce sujet en public et parler du plaisir, parler de comment on peut avoir le plaisir, tout le monde s'entendait à ce que vous êtes en train d'intoxiquer la communauté et vous les incitez à faire le sexe. C'est progressivement en intégrant l'éducation sexuelle complète à la sexualité que les gens ont commencé à comprendre que le sexe, ce n'est pas seulement aller faire le sexe, mais on peut faire le sexe, mais positivement, sans pour autant toucher sur les normes et coutumes. Alors, ces normes-là ont été vraiment une barrière pour que la santé sexuelle et reproductive soit bien sensibilisée et intégrée dans la communauté. Parce qu'on avait peur et honte d'être stigmatisé. Quand on parle de ça, on vous indexe comme quoi c'est vous qui intoxiquez la communauté à faire le sexe. Merci.
Thank you so much. Yes, totally agree. Kadest, please go ahead.
Very nice presentations, very interesting topic. I'm not currently working on SRHR, but until 2 years ago, I've been working on adolescent and youth reproductive health and family planning SRH in Ethiopia for many years. And one of the barriers even to delivering a good AOISRH service, especially concerning adolescents, is that people believe, especially those the decision makers, politicians, are always pushing back because they think that even educating adolescents and youth on SRH entice them to go more into sex, to practice sex early. They think that it leads to GBV and other issues, which actually we all here know has quite the opposite effect. And I think one of the issues why pleasure historically has not been included in these programs is just because of that. Like once you start talking, associating pleasure and sex, it's interpreted as just, giving everyone to, allowing the youth and adolescents to just go ahead and have sex. So that is one of the reasons why it's been excluded, and especially in countries like Ethiopia, where the society is very patriarchal. It is really difficult even with adults, and really difficult to talk about pleasure, to talk about sex. And one thing, and I will stop quickly, but one thing I will suggest is to take this, even the discussion about pleasure, to clinicians like obstetricians, gynecologists, midwives, who are not into SRH programming but are actually providing the service, to integrate it with their service and to talk about it. Thank you so much. It was a pleasure being here.
Thank you so much, Kadest. I think that's a really great point. And Jess Alfred's project is a fantastic example of how you can integrate pleasure-based programming into, the work that providers are doing. And that's something, to Leanne's point earlier in her presentation about, one of the misconceptions being that integrating pleasure is really just for young people. But as we now know, pleasure is really important for, sex at all ages. And so how can we start thinking about integrating that with different age groups? Curious what others think about that. Do you have any other examples from your own work of where pleasure has come up? Some of the challenges that you've faced, or, any success stories that you'd like to share? Just curious where this has come up in your own work.
Je peux prendre la parole, Alfred? Just Alfred? Ok, merci. L'expérience que je peux partager ici, quand vous évoquez la question des jeunes, des fois, il y a des barrières même dans la communication. Mais nous, dans notre rayon d'action, nous avons exploité une jeune association de filles, des jeunes qui émergent et qui donnent des informations online. Alors, ces jeunes ont une ligne verte, c'est l'association qui s'appelle Initiative de jeunes filles en action, IGFA, et ces jeunes ont une ligne verte. À travers cette ligne, les gens pouvaient s'acquérir d'informations qui avaient honte de parler à tout le monde. À travers cette ligne, il y a une application où les filles peuvent cliquer et avoir les informations calmement, en toute confidentialité, avec le robot prestataire sur la santé et sur l'approche de la santé sexuelle basée sur le plaisir. Et ça fait à ce que le téléchargement de cette application augmente en cascade. Et quand vous voyez la tranche d'âge, ce sont les jeunes qui souvent entrent dans cette application pour essayer de savoir ce qui s'est dit sur l'approche de la sexualité basée sur le plaisir. Donc, des fois en live, comme les normes bloquent, et les associations trouvent des contours pour essayer de contourner ces obstacles et donner l'information, une bonne information sûre et confidentielle en ligne à travers les lignes vertes, les hotlines et les applications. Ça, c'est une expérience ici chez nous où on a associé une association de jeunes qui ainsi transmettent les informations dans leur catégorie de tranche d'âge, les jeunes, et maintenant, il y a une adhésion massive. Même les jeunes dévoilent ça à visage découvert dans des réunions. Ils parlent maintenant de l'approche du plaisir dans leur santé sexuelle et reproductive. Merci.
Thank you so much, Jess Alfred. Anne, I saw you shared in the chat an article about the importance of sexual well-being throughout the life course. Curious if you have anything else to share related to that.
Well, it's just because you'd mentioned it, but it's an article, and I think Tim is on the call from UNFPA, but it's an article that a number of us wrote about, and also it speaks to the point that Kides said about menopause. So it's about the fact that pleasure isn't just for one particular age group, and people sometimes assume it's for young people, for example, or they assume it's for particular sexual identities. And no, it's, you know, pleasure is something that if people have the capacity to feel if they want to, and that's through the whole life course, you know, until older age. And in fact, there's taboos and stigmas about menopause and pleasure or beyond menopause, but absolutely it's important to recognize that people at all ages can have pleasure. And I think it's also important to recognize that pleasure isn't just for unmarried people, or it's not about people having multiple partners. You know, there's so many great examples of faith-based organizations who are, you know, who believe that monogamy is important, but who talk about the importance of pleasure within that monogamy, and in fact how having a pleasurable monogamous relationship makes it a more successful long-term relationship. So I think we need to also make sure that we shake off our misconceptions about what we think pleasure is and who it's for.
Thank you so much. And Leanne, please go ahead.
Yeah, I think just to two things. One being, you know, I saw from the chat and things, there was almost a perception that I think, you know, if we incorporate a pleasure approach, are there different ramifications? Are there consequences? Is it something new that we're doing? And I think it's not to say that people can't keep doing what we're doing, but I think particularly for folks who work in contraception and maternal health, there's just been this almost like very difficult to believe glossing over an aspect of health that's so integral to people having sex, and somehow we manage to not talk about it at all. So I think that a lot of the incredible work that's been done around empowerment interventions, around community-based, grassroots-led work, like none of that changes. It's just, you know, creating a space where we can talk about the thing that is bringing everyone for health services, which is the fact that people are having sex. I think like if we can do that and keep doing all the best practices that we've seen in the SBC world and in the SRHR space more broadly, like I think that that's fine, and it's not a either or. It's not reducing rights-based interventions. It all still needs to be there. We still need to be communicating. We still need to be building more equitable gender norms. All that's still there, and we're just talking about sex. And then I think to what Anne and Kiddis was saying, I think great points about the life course and making sure, I think, you know, we look at, like everyone outside of young people who are young and, you know, have impulse control issues or whatever. It's like when everyone gets married and becomes respectable, suddenly, particularly if you are you know, born in a female body and are a married woman, let's say, you just become desexualized, and then you are wife, you are mother, and your needs don't get looked after. And so I think accounting for these things also lets us look at sexual health more broadly and see maybe the areas of health where we haven't been as holistic as we need to be.
Thank you so much. And I am really sad to cut this conversation short because I think we could really talk about this for so long. But unfortunately, we are at the end of our time today. I really want to thank all of the presenters for sharing your work and your thoughts with us. I know I have a lot that I want to think more about after this discussion, and I know others do as well. There were several questions in the chat, especially from the first Q&A that we weren't able to get to, and so we will compile those. And then also perhaps provide some written feedback or written answers to those questions from the presenters after this call. And I want to ask if you have a moment to just please take some time to fill out this quick meeting survey. It really helps us ensure that the content that we are putting together in these meetings is useful and valuable to you. So we'd love to hear from you. And I will also share as a final kind of a think piece here, a video from the Pleasure Project in the chat if you're interested in taking a look after you sign off. We will also be sharing and compiling all of the fantastic resources and materials and the videos that the presenters shared today for you in the meeting summary that will be coming out in the next few days. So thank you so much. I'm going to just go ahead and paste this video in here that you can take a look at now if you'd like. And we will stay on for a few minutes as people are filling out the survey. But again, just want to thank the presenters, really appreciate your time, and all of you for your fantastic questions and a rich discussion. So thank you, everyone.